This podcast is for informational purposes only. It is not intended to provide medical advice. It exists to entertain and to inform. Hey listener, just a quick heads up here that we're going to be talking about a case that heavily involves GI stuff, gastrointestinal stuff, and that means some poo talk, some diarrhea talk, that sort of thing. So just be aware before you get into the episode here. Also, Mike was having some technical difficulties, which he managed to work out, and he will come in out of nowhere at some point in the episode. Just so you know. Get to the show.
We look at cases throughout history. You should stare at Alba Max and me. You gotta listen, you don't have to read.
Welcome, everyone, to another foray into the Curious Case Vault. This is the spin-off show where we will, from time to time, do our best to figure out what happened in a real case from the oldest of medical journal archives, and find out what practicing medicine was really like back in the day. These cases involve ordinary, non-famous people and the ordinary, non-famous physicians of the day who treated them. Some things have changed a lot, some things not so much. I'm Dr. Max, and I'll be joined by Dr. Aaron. Hello, sir.
Hello, how are you?
Good. As we play the role of sensei to our medical history intern and enthusiastic grasshopper, Alba.
That's me.
Yeah, and she did all the real work for the show today.
Mm-hmm.
So, Alba, you found and studied a case from super long ago, and we're going to try and help figure out what happened. Is that the plan here?
That is the plan.
Now, a lot of people actually wrote in. They really liked this, so no pressure, but let's not mess it up.
All right, I'm going to do my best.
I was talking to Aaron.
Oh.
Mm-hmm. I'm just trying not to mess up. That off on the wrong foot. You go ahead.
All right. No. Okay. I take you, gentlemen. I take you to Sidmouth. I'm guessing that's in England.
Yes, this is going to be from England based on the journal we pulled it from.
They're all going to be. Okay, because it's from the Provincial Medical Journal. Okay.
Yep.
Folks, I take you to Sidmouth, England. It is November 14th, 1842, and our patient's name is Anne Nash. She's 30 years old.
Still weird that they have that in the journal. Just going to say.
Her name?
Yeah, just her name and her age and where she's from.
We go find her, well, if we had a time machine. So she's struck suddenly with pain. She's got pain in her side and in her chest, and she's got occasional palpitation of the heart. So she's feeling some heart flutters.
Flippy flops.
Yeah, she's got the flippity flops. She is at her brother's house, and she suddenly gets sick there. So then she's got really bad pain.
He cooked.
He did not cook. No. Well, it doesn't say. Maybe he cooked.
Do we suspect him?
Well, if the brother cooked, then
That's what I'm saying. We digress.
I'm regret to disappoint you, gentlemen. It actually says, I could not ascertain that she had been eating anything the day before, which would be likely to agree with the stomach. So
wait, he's just saying, I don't think she ate anything that did this. Come on.
Yeah, you don't know that. It's 18, what is it? 1870s, 1840. Everything disagrees with that.
1842.
Stomach. He didn't know. They didn't know.
He's got no idea.
You're eating like gruel made out of barley found on the floor of a barn or something,
full of bacteria.
Yeah. How does he know that?
Fair amount of mutton in here too.
There's mutton. Either way, I think it's a little presumptuous of him to be like, it wasn't something she ate yesterday and then developed these symptoms today. Come on, doctor.
Okay, it is not right. So it's a mystery, maybe. But anyway, she's at
the listener cannot see you doing that with your fingers. And
I'm sorry. I did sneaky hands. Yeah. Maybe. It's a mystery. Okay.
Come back, Alba.
So anyway, she gets sick. She gets sick at her brother's house. She's got really bad pain in her bowels, violent pain in her bowels, in fact, with vomiting and purging, which I took purging to mean diarrhea, maybe, because he says it's separate from vomiting.
I think you generally will hear them say purging a lot, and it can refer to vomiting and it can refer to diarrhea. I think I've definitely seen that in the literature. What do you think, Aaron?
Yeah, agree. I don't know if it's that specific. I mean,
getting rid of.
Yeah, just probably both ends. Coming out both ends, as we say. Sitting on the toilet with a pot in your hands. Yep.
Yeah. Now, I
times.
learned in a previous episode, I heard y'all refer to that as splanknic sloughing.
Ooh.
Oh no, that's when you're bleeding.
That's
When all
one
of your
possible
like,
cause of bleeding. Yeah.
okay, when all of your stuff is it's just like, hey, let's get out of here.
Yeah,
And you're
splanchnic
sloughing
referring to
off
like
your insides.
digestive kind of organs, and then sloughing referring to exactly what that word sounds like, of
shedding.
the inner lining. Yeah, but
Mhm.
but yeah, I mean, purging can be as Aaron said, it can come technically it can mean both ends.
Great.
Yeah, so I would use the less specific term gastric emptying. So just
Mhm.
you're emptying everything out of both sides.
Removing it violently, as it were.
Yeah. Just to distinguish it from, oh, I threw up
That
once
makes
and I had
sense.
some diarrhea. Like, no. It's more dramatic than that. This is level 2 or 3
It's
or
gastric emptying.
Yeah, like we're just gonna get everything out of our system.
Yeah, we're not draining, we're emptying.
It's
Everything's
Correct.
coming out.
Correct.
Everything must go. It's the fire sale of
Okay.
whatever's in your GI tract.
So she's vomiting and purging. She's in a bad way. And but it says instead of fluid resembling a rice gruel, which sounds like he was expecting it to look like rice. It was just a lot of dark blood.
So now Aaron
But
and
it-
I, we have very fond memories, I'm guessing, of rice gruel in the context of a GI illness and description. Aaron, did you see the rice gruel video in medical school?
Oh yeah.
This is a legendary thing that
100%.
happens.
Yeah.
I have definitely talked to more than one physician who did, and Aaron and I did not go to the same school, to be clear.
No,
but
it's the rice.
It's the 1970s or 60s video that has to do with cholera. And so it was part of our infectious disease class. We were learning about what cholera is. And the infectious disease professor, who's this amazing dude, he was just like, I'm going to show you this video. And I make every class watch this video. And I think that's been going on for probably now the last 50 years because it's just the video is so memorable. And it does take you through the symptoms of cholera shot on like a newsreel type thing from the 60s or 70s, like, you know, those informational documentaries where you get the nice soundtrack coming in and it's just whatnot. But the description of the diarrhea is rice water. And not that I've ever made rice, like been on a rice water patty.
Rice gruel. Yeah,
I made rice, I've done all that sort of thing. The video had very vivid visuals of what this looked like, and it's a very apt description. And typically from cholera, the reason it's so dangerous is that you get so much diarrhea, and it is predominantly diarrhea. They actually have these cots. They're called cholera cots, which are rubberized beds that have a funnel at the bottom because this awful
kind
effluent,
of in the middle,
if we will.
Kind of in the middle.
Oh my God.
Is exactly it basically it
and then a bucket underneath.
Correct. People typically die from this because you lose so much fluid. But it looks like rice water gruel. And so yeah, like just think really thin, slightly brown oatmeal.
Yeah, it's like the DMV video of medical school, like the one you had to watch where you're like, oh God. Yeah, we all watched kind of through our fingers. It's impressive. But to this day, cholera, that's why you can actually save quite a few lives with a tiny little like rehydration pack. Because really, if you just keep up with the hydration for cholera, people can still. That's why it doesn't kill people in our system as much, if at all.
In the modern world, yeah.
Because you just give fluids and you give IV fluids and you replete everything they're losing. And
we can definitely talk about how cholera works as we get through this case a little bit more.
Okay.
Yeah. So he's like, but he said not like expected. So he's thinking it should be cholera, but it's not.
I'm wondering why. I'm wondering up to this point. So she's hurting, she's puking, she's pooping, but why he immediately goes to cholera? I don't know. Maybe because it's
just so common, I think.
Common and then
there would just be routine outbreaks all the time, and especially in England during that time. So
I think our first episode actually talked about the Aaron, you wrote that episode.
Yeah, all the way back.
Yep. And it was just common.
So it's mixed. So it's unmixed with food. So it's just blood that's leaving her body. And he makes a note about the offensive nature
Mhm.
of it.
Correct.
So
The offensive nature of the smell, and in this sound, I mean, it's easy to roll your eyes and be like, yeah, it's diarrhea, of course. I will say there's a nuance to it, though. Like there's a certain quality to different kinds of diarrhea where once you have enough experience, you can walk in the room and be like, there is a GI bleed in this room, or this is C. difficile diarrhea, which is a certain infection.
That one's kind of fruity. It has a
it does have a little. It does have a little, and then there's others that you're like, ooh,
it's got a sort of a nose forward, sweety fruitiness to
absolutely.
it. Sort of a full bodied,
but
aromatic bouquet, if you will.
I am so sorry, y'all.
I'll put a disclaimer at the beginning of this episode. Don't worry. So what this guy is also saying, because he's saying, yeah, I'm expecting kind of this rice water look, but there's blood here. And that blood is not usual for cholera. Blood is not, because of the way that cholera works, this might be a reasonable time to talk about it, that when the bacteria gets into the gut, it produces a toxin that basically makes your intestines start putting water into... leaking water into the middle of the intestines. So it doesn't really rip apart the intestinal walls like some other infections can. Now, granted, if you have tons and tons of diarrhea and all those tissues down there are getting really beat up, you can have some blood, but this is like a lot of blood, the way that they're describing it.
Yeah.
And so it's not that you can't have any, but I would say cholera and bloody, like really bloody diarrhea is unusual as a mix. And I think that's why this physician was writing this up to say there might be something different.
There's something different here.
Am I far afield there, Aaron?
No, not at all. Yeah, that makes sense. I mean, we spent a lot of time talking about diarrhea in our infectious disease class, and there's definitely nuance. But yeah, there's a whole class of medicine or infections that don't cause bleeding, and then another whole class that do, and that they have a different way of affecting you. So the blood's unusual. The pain is too, right? Because so if it's just cholera shouldn't be painful. You might feel awful because you're dehydrated, but you shouldn't have severe bowel pain, really.
You get some bubble guts that are not fun, but they're not severely painful. And so I think this physician is writing this up because he's like, there's some things that don't fit. Like I see every other patient has cholera in my practice is probably what they said. So this seems different.
Yeah. Okay. So, so when he gets there and he gets to see her, her positioning is she's got her legs drawn up. She's having severe cramps, and he describes it as violent and continual pains in the epigastric region. So like the upper middle part of her abdomen.
Like right under your breastbone, your xiphoid process, the upper abdomen, right in the middle there. Yep.
Mm-hmm.
And her skin of a livid and slightly blue color. So she's blue and she's cold and clammy.
Bad.
Yeah, it does not sound good.
Mm-mm.
Also, her tongue is white. She's got extreme thirst, which under the circumstances of bowel emptying makes sense. Her pulse
purging is the word we want to use.
Oh yes, purging. There we go.
It is the purge.
Purging. And her pulse is only 45, which is pretty low, right?
I thought that was interesting. I did note that as well.
That's very interesting.
So she's what, 30 years old, right?
Mm-hmm. Yeah, she's 30
we
years
have a
old.
surprise Mike coming in.
Look at
Hi, Mike.
this. Golly.
Wow, surprise side tackle Mike. Mike, we are...
We're in the middle of a case.
Oh, really?
Yeah, no, just join us. Let's see.
It's fine. Yeah, I just got my associate's degree in IT.
Nice.
Excited about that.
For
Excellent.
the listener, Mike was troubleshooting his computer and seems to have had a victory. Well, here, I'll give you the quick summary. This is the 1840s case of a 30-year-old female. Doctor gets called to her house to because she's having lots of bloody diarrhea and bloody vomiting. That's as far as we've gotten. We just talked about cholera, kind of how it works.
Severe,
a lot of abdominal pain. We literally in the middle of like her being described as in the fetal position and just
she's pale.
She's pale. Oh, and we were just about to talk about bradycardia. Yeah.
Do we have her molybdenum level?
We haven't checked that yet. This is.
I don't even know what that is, so I can't give you Lipton levels.
No, molybdenum. It's one of my favorite.
Like tea, it's a
elements on the
good tea. I
periodic
like
table.
it.
But anyway, you were about to say her heart rate is low, right? What was her heart rate again?
Yeah. So her heart rate is only 45, and he says it's fluttering, which I'm not really sure what that would mean.
Yeah.
I don't know if he knows what that means.
We don't know. So that
Maybe
there's
she's feeling it fluttering.
yeah, this
But a
is
low heart rate here is interesting. Wow. Aaron,
Oh,
why
man.
why is the bradycardia interesting?
well because it's paradoxical. So it's not the expected response. So you should, if you're in shock, your heart rate would normally speed up
Or
instead
you're
of
really
slow
dry
down.
in this case, right?
Right.
Super dry and dehydrated.
I still don't know that you're going to get Brady.
Right. So that's why I would call it paradoxical bradycardia.
Oh, I see.
Yeah. So it's not what you would expect.
If you're dehydrated, your pulse is likely to go up.
Right.
Likely,
You're gonna.
yes.
Yep.
Okay.
So you don't have enough blood if you're dehydrated. You don't have enough volume. I don't know. People are going to make fun of me again. But so one of the responses will be your
No, I
heart
get
rate.
it.
You'll speed up so that you get more circulation to continue to give your body what it needs as far as oxygen and so on, with less volume. So you have to speed up to compensate. So yeah,
that
so
makes sense.
this doesn't make sense
But
necessarily.
I wonder,
So
because this is like a description of an overwhelming GI affliction, is she having a vagal response? So her intestines, the vagus nerve is this big nerve that runs from your brain all the way to your gut. And even new science now suggests that there's probably a two-way communication where the vagus nerve can actually, or the intestines with their activity can send signals back up to the brain. Long story short is that when you get nauseated or you have a ton of diarrhea, you can have this nerve be very active, and it can have the effect of slowing down your heart. And so it could also lower your blood pressure. A lot of people do pass out with diarrhea, sometimes because they're really dehydrated, or sometimes they just move their bowels so forcefully, if you will, that it can cause the heart rate to drop. And it also happens with nausea and vomiting. A lot of people who get nauseated, sometimes it's accompanied by that lightheaded feeling. And so sometimes your heart rate can drop. Now, I don't know if her heart rate
It's going to
was
be temporary.
correct. I was about to say, I don't know if her heart rate was like he just checked it and for a few minutes it was like this and then it went back up. He's not exactly putting her on a cardiac monitor.
Yeah, it sounds like it stays low because I think the next day he describes it as 40. So it sounds like it's pretty consistently low.
So yeah, so it could be that so there are times when what you can feel, especially if you're checking at the wrist, does not reflect the real heart rate. So you will get times you can't feel all the heart beats, especially with if it's fluttering and it's what's called atrial fibrillation. You'll only feel some of the heartbeats, so the electrical rate might be very high, but because she's in shock, you don't feel them very often. That's
Or
one possibility.
Oh, sorry, I don't mean to step on your point. I'm just thinking out loud. So she's had tons of diarrhea, could be goofing up her magnesium. So she might be having very low magnesium, which can make your heart do a lot of extra beats, what we call either PVCs or a rhythm where you have like a abnormal beat, normal beat, abnormal beat, normal beat. And sometimes you only feel the normal beats when you're checking at the wrist. So certainly her heart could be doing all kinds of weird stuff with like profound, overwhelming GI losses of electrolytes like magnesium and potassium and stuff like that. So yeah, it might actually be a real heart rate, and there's a bunch of reasons it could be that way.
Or the thing where he says the next morning it was the same. When I first read it, I'm like, oh, she's about to die, because if when you like get to the point where you're like fast, and then you're just done, like the steep part of the cliff, when you get super sick, you might get slow because your heart's just like, your blood pressure is so low that you can't supply blood flow to your own heart. And then the heart's like, forget this, I'm out of here. And everything stops. But if that were the case, she would be on the way to Gonzo. She wouldn't do that through the night. So that doesn't make sense.
Okay.
Well, she could. Yeah, and these young people are usually good until they're not.
Yeah, and young people, 30 isn't young in the 1840s, though. That's the thing.
No, she's a
yes, it is.
She's geriatric at the time.
She's her great grandchildren are ministering to her around.
Well, and I mean, if you like reading through this case too, the other thing is there's like, he basically goes over to the kitchen drawer and just like opens it up and takes out every substance there and just starts putting it into her. So there's so many
can we start
things.
with
what does he do?
What his first move is?
What's the good doctor do?
She's in a real bad way, right? She's in a real bad way. And his go-to is one large tablespoonful of brandy.
Nice.
Yeah.
With,
It's a Wisconsin case.
So give her booze. And then arrowroot, opium. And then I did not recognize the other things, but it sounds like the kitchen drawer. that Max was describing.
I'd like to see your
Aromatic
kitchen drawers. Jeez
confection.
Louise.
Yeah, I don't know what
Yeah,
aromatic
well-
confection was. I did not look it up. I just
That's the bitters. So when you make an old fashioned, you got to put the bitters in the brandy. That's so.
you
this
don't
is a
make the cocktail
Wisconsin
in the
case.
patient though.
You do, yeah. When does he shake her?
Calomel. Does
does
anybody
he
know what
stir?
calomel is?
No, calomel. I think is yeah.
So
isn't
I
that
looked
what-
up calomel because I see it tossed around a lot in these times. Calomel it like
Yeah.
comes from
It's
a
another
tree,
purgative,
tree
isn't it?
wood. Well, they used it for a lot of things back then, and still to some degree now. Oh wait, no, camphor
sure
or
it's-
calomel? Which one?
It's mercury. Good.
Calomel is
Calomel.
mercury. Camphor. All right, so let me back that up. So calomel is mercury medicine.
Sure. Always good.
It
Is
is.
that a good idea to give somebody
No.
mercury?
No.
No,
Okay,
it's
I
never.
didn't think so because that's why I
No.
shouldn't eat so much fish.
No, calomel. It's also a purgative. It makes you vomit. It makes you. It gets your bowels moving too, which is it seems like the last thing she needs. But this is
Is that what that
medicine in the
song's about?
1840s.
So
You got to purge the evil humors, man.
It's
Help her.
my purgative. I can puke when I
I'm
want
also
to puke.
saying if I'm throwing up, the last thing I want is booze, to put on my
Well, no,
stomach.
you know,
and-
Hair of the
it's the
dog,
hair of the
hair of the
dog.
dog.
It's the only way to quit feeling bad is to
I mean,
start
look,
again.
it's not all bad. She got some opium too, right? Which
Yeah.
actually,
yeah, she got
that would
to
slow
give
opium.
down.
That's
credit
good.
for diarrhea, that would help. And
Yeah, it would. It
pain.
would
So
slow you
there-
down.
That's
That'll
honestly
slow
one of
down
the
your stuff.
somewhat reasonable moves here.
Mhm.
Arrowroot, I did look up. It's used in cooking. I didn't really find a lot of medicinal things, so probably benign
yeah,
here.
I think, yeah.
So the only
Okay.
thing we would think about doing, we would potentially do the modern version of opium. If she had severe abdominal pain, we routinely use opioids.
Okay.
In the right case, yeah. There's also like
Mhm.
Lamodal, which is it's kind of works like opiates, but on the gut, and so it would be something. But yeah, I mean, that's the one medicine here that does kind of make sense in the context.
And so he also, which I really did not understand, said legs to be tightly bandaged.
It's to make sure
What?
she doesn't have sex.
Oh my God.
It doesn't say bandage them together.
I don't know if he was just like her pulse sucks, and I'm gonna wrap up her legs to like preserve circulation to the rest of her body. Would be the
Okay,
most generous way I
yeah.
think of it.
So he is like clamping the aorta.
Before
that was a thing.
So all the blood's all over your body. You wrap up the legs, and now the blood doesn't really get to the legs; it stays in the middle.
Yeah.
Okay.
All
I'm
that's
trying
going
to
to do
think.
is
I'm trying to think through his.
Is this Lieutenant
his way.
Dan's disease?
Yeah, more or less.
Can't
good.
feel my legs.
And maybe the water too. Maybe he's like, we're going to squeeze the water out of your legs into the rest
I
of your
mean,
body. I don't know.
It's weird, but it could kind of work. Don't do that though.
No. Mm-mm. So evening time comes and she still vomits a small quantity of blood.
Blech.
So she's still throwing up. She's still got pain in her right side. She can't bear pressure. So I took that to mean she's like tender to palpation in her abdomen.
Yeah, he's trying to press on her stomach and it hurts.
Yeah, and or take a slight inspiration. So she's in so much pain she's not taking deep breaths. Is how
Yeah.
I read that.
Yep.
Then he gave her mustard poultice.
Poultice.
What? Poultice.
Yeah, do you know what a
For
poultice
that?
is?
What is that? I don't.
I have to look it up every once in a while because it comes up and I always forget because we don't really use it. Poultice is like you make a mash
Speak
of.
for yourself.
Okay, well,
Mhm.
fair. Aaron uses a lot
Aaron's-
of poultices.
he's eating a poultice
I've
right
seen
now.
one in practice. I've seen one poultice in practice, to be honest.
What?
But what? Yeah.
Wow.
So
Oh, boy.
it's a mashup of like plant material. You kind of moisten it and you slap it to the skin and bandage over it. It's
It killed
You
Daenerys'
know-
husband in Game of Thrones, man.
there you go. Yeah. So
Yeah.
it's kind of an old timey wound care thing. It's
We do
mostly
it for
just
dry
putting
sockets.
debris. What's that?
That's
do it for
true.
dry sockets,
You're right.
like-
Hey,
So,
there you
yeah,
go. That's a modern.
cloves and-
Yeah.
It's a
Well,
poultice.
one interesting one. I had a patient who came in once with a wound, and they went they went to I don't remember what they said. I think they said shaman first,
Mm.
and then they had a mash of tobacco and some other herbs mashed into the wound,
Mm.
and then they came in and they were bleeding pretty good up until that apparently, and I was just like, well, why did you come in if you stopped there? And they were like, well, the shaman told me to go immediately to the ER and asked why I stopped there first. And I
Wait,
said, fair enough.
Was there
Uh,
toilet paper in there too?
No, it was, but it
I
had the
thought you said there was
nicotine.
shaman.
That's the cleanest mic joke ever. So no, but honestly, it kind of made a little because the nicotine would sort of be a vasoconstrictor, right?
Yeah,
Mhm.
decrease blood flow,
In a
yeah,
way.
yeah.
But then again, I was like,
What's a
there's a bunch
vaso-
of it just like clamps down blood vessels, makes them
Okay, cool. That's what I
squeezes them
thought, but I
down,
wanna
so
make
maybe
sure.
less bleeding. But then I was like, it's a bunch of plant material just stuffed into a wound, and I love it.
Yeah.
Cleaned it out.
Yeah, vasovessel and then constrictor versus vasodilator,
Vasovessel.
which is the
Okay.
opposite.
What's the poultice for eye sockets
Mustard
with?
poultice. Yeah,
Well,
close.
so it's like, yeah, you could use
Oh,
cloves
yeah,
or
okay.
technically,
clove
yeah.
oil.
You put, I mean, yeah. All right, so he's got a lot of
Yeah,
good stuff
so-
going on. She's got her legs bound. She got some opium. She got some
Basically,
brandy.
she's still sick.
Some
Yeah.
mustard on the
He
skin.
gives her some mustard on the skin. Then he puts flannels on her. So he's like, well, we got to warm you up, lady.
This is
And
Wisconsin.
give her.
Yeah.
This is 100%.
Also,
He wanted her to die as a lumberjack.
she gets more brandy too, a wine glass this time instead of one
The
large
increased dose.
tablespoonful. Yeah, she gets an increased dose. So yeah, and then basically she's continuing to have issues the rest of the night. She's still in extreme pain. Then her hand seizes with a cramp. I thought that seemed kind of out of the ordinary.
This one's actually that's actually kind of cool. Because she probably. Do you guys have a theory as to what you think might have caused that?
Did he?
She was probably really acidotic and she was trying to compensate. So respiratory rate went up, CO2 went down.
That's one
and
probably.
then, hyperventilation.
Did he
syndrome.
tap on her cheek?
Well, yeah.
or
so
hypocalcemia? Yeah.
yeah, because she's probably pooing out a lot of calcium. If her
Mm.
calcium levels
Okay.
are low, you actually start to like you can
Oh.
start to seize up. Like your
Moans,
muscles.
foams, groans, psychiatric overtones.
That's the opposite. That's hyper.
Yeah, that's hypercalcemia. That's too much
So-
calcium.
If you tap on somebody's cheek who has low calcium,
It'll twitch like uncontrollably.
twitch?
Yep. Yeah. And then when you
Oh,
check their
wow.
blood pressure with a blood pressure cuff, they'll get like a cramp of their arm. So
Oh.
that could be it. It also could. I mean, you can get cramps from low potassium too, or just as Mike pointed out.
I thought
just
that was
being
kind of cool
acidotic.
because when your calcium is really low, and I'm suspecting a lot of her electrolytes are pretty low based on what based on this
Yeah.
case.
he basically continues pretty similar stuff, continues on. So he gives her another poultice. He gives her more, as Max described, everything in the drawer. A syrup of poppies. He gave her spirit of nitrous,
Ooh.
carbate of ammonia. Camphor mixture.
Yeah, that's
What are
used in a
these
lot of
things?
like kind of old timey medicines. You can be toxic on camphor, but you have to like really try. It's sort of a mothball alternative, but it comes from a tree bark, and it was used for almost everything. It like treated everything back in the day, and it's still used here and there, but it's not like I'd say it's one of the more benign substances I think he's given.
So is ammonium carbamate or carbate of
Oh
ammonia?
wait, no, hold on. Let me back that up. Sorry, it was also I forgot I wrote this down. So in the 20th century, camphor was used to induce seizures in schizophrenic patients. Which
Boo.
is not ideal. Not ideal.
Yeah, so he's trying to make her blood vessels larger there if he's doing nitrous and ammonium carbamate, maybe? I don't know.
Sounds like he's trying to finish her off because he's sick of dealing with her.
Well, he might. Okay, so again, to be like, what's he thinking? If her extremities are all really cold and pale, maybe he's trying to get blood flow back to the legs that he bound very tightly to decrease the blood flow. I don't know. None of it's a good idea.
At this
anymore.
point,
he's flailing. He's throwing the kitchen sink at this lady because he's
Did
like,
she have
she's
chest
so
pain
sick.
too?
Give her everything.
She did have pain in the side and in the chest at first with occasional palpitation of the heart, but he doesn't mention that after that first beginning. But he did say that the pain in the right side was relieved and the left was now affected. So somehow her pain from her right side had moved over to the left. But earlier he described the abdominal pain as being in the middle in the epigastric area. So I'm not sure.
You're kind of getting pain in different areas of the abdomen as this progresses.
Okay.
It's because the goblin is jumping from the liver to the kidney to the. That's what happens.
The goblin?
Yeah.
Mhm.
Yeah.
Intestinal goblins.
Mm-hmm. Sorry, just kidding.
It feels that way.
Yeah.
Well, y'all are doctors, so I'm like, oh, is that a thing?
She's,
Is there something in your intestines that you call a goblin? It could be. I don't know.
When we're at a loss for words, yes.
Okay, cool.
sorry.
So he keeps giving her brandy. Vomiting still continues, but he says it's only the brandy and the water that she'd been taking. So I'm like, if I have too much brandy, I also throw up. So her bowels slightly moved, and he calls the discharge very offensive. So she's this really, really smelly poop still. She's still super she's really thirsty. And same thing with the brandy. So and then he continues to talk. He starts talking about her bowels not being open, and then her bowels being open.
Yeah.
And so I'm taking that to mean she didn't poop for a little while. Like she got stopped up for a little while.
So there's definitely, when you read some of these cases back then, I think there was not a lot they could do at all about anything, medically speaking. And so there seemed to be a want to control some, so bowels, there's a lot of fixation on bowels. And I know, he was called to the house for diarrhea. I get that. But it's sort of like, oh my gosh, I'm treating the diarrhea. Now the bowels aren't moving as much. Now, mind you, from what I recall here, it's been a diet of sips of brandy in between vomiting bouts. So I don't think she has much left to have a bowel movement with. But I think the case is like, oh my gosh, my medicine works so good that now we're not having any bowel movements. We need to correct that ship and get back to something. Now, I'm editorializing a bit there. I don't know really if that's what it was. But when you see a lot of these cases, a lot of them fixate on like, we need to have this many bowel movements a day, et cetera, et cetera. But the true fact is that everybody's different. And when you're sick, everything gets out of whack. And just have you ever gone like camping and you have, or what is it called, vacation gut? Like you go camping and your body's like, I'm not having a bowel movement for 2 weeks because this is gross. And so
speak for yourself, man. Trail poops are very satisfying. You gotta just
if you drink enough on those trips, you don't have to worry about that.
You're just scared of pooping in the outdoors. I didn't know this about you.
Yeah.
I just learned more. Yeah. No.
So Aaron
Camping
pees
is
and
awful.
poops standing up when he camps.
No, man. I just go to places that have pit toilets.
Oh,
Those are
the
key.
worst. Oh, they're so gross.
They're gross,
Don't go
but
camping. Why does
It's pretty
anybody go
bad.
camping? I really don't get it.
What? It's fun.
the outdoors is beautiful.
It's never been fun once. I've gone
Nature.
like 8 times, and for the next person who tells me, "Oh, you just haven't done it right," I was like, "Well, I've done 8 different kinds with 8 different groups of people."
That
and none of
sounds
them
like
have
a
been
good
fun.
try. I think you just aren't a camper. I think that's okay.
Thank you. I agree.
That's
He's an
okay.
unhappy camper.
Aaron, can you
The
talk to my
data's
wife
there.
about that?
Just say, I don't think Max is a camper. That's,
she
it's
knows.
not going to work.
She knows.
All right. So
Well,
she's,
the data for camping might be there, but the data for these poops is not there. So it doesn't seem like that's something important to track. But even though it sounds like that he shouldn't, it doesn't really matter, but he thinks it matters.
Yeah, and isn't this the part where he starts throwing enemas everywhere? He's like,
yes, this is where, so now
Oh,
he
no.
starts giving her, because her
No.
bowels are closed. But I do want to say her pulse is now 40 and
This poor
still
woman.
fluttering. Her tongue is still dry, and he blames it on the opium. He says tongue rather dry, probably from the effect of the opium.
I mean,
Well,
Which I'm like,
maybe.
I'm sure it's not helping, but I
It
don't
could
think,
probably be
good
the
sir, that's the whole
dehydration,
explanation.
maybe.
Sounds like he's copying and
Yeah.
pasting his note.
Oh, okay. So he starts doing enemas now?
Yeah.
No,
Yes. And then so
don't.
he with an enema of gruel. So he's giving. So I don't know what gruel is, but he's giving her gruel up the
Do you think
tailpipe.
he could feed her? Maybe.
I don't.
get it.
And I'm not really sure why he hasn't tried feeding her because he doesn't say
Says-
that she won't eat. I mean, maybe because she threw up the brandy.
Kept drunk for days while vomiting. So,
Maybe he's like, well, if she can't keep brandy down, she certainly can't keep gruel down.
that's true.
It's like, let's
That's
feed her
true.
some way. You cannot do this, people. Everyone of the
I-
internet, don't try to feed yourself rectally.
Yum, yum, yum.
He gives her more arrowroot and brandy to drink. So
I mean,
he's like,
at
you
this
can
point,
still
might as well.
keep drinking the brandy. So that evening, she poops.
Thank
Her bowels
God.
are no longer closed.
Is it all just gruel?
She
Yay.
poops. The feces are very offensive and they're tinged with blood.
Oh,
But that's better than just a bunch of blood. So, I mean, it's still improvement.
So then he orders this time he calls it an injection with gruel and oil to be given.
Yeah, I didn't
But-
know where that was being injected, and I didn't want to ask.
Hopefully not into a vein.
Yeah, I'm
Yeah.
wary of that word injection given what he had previously said.
Let's hope
A
feeding,
gruel
just
embolus?
regular feeding. Ooh.
Yeah,
oatmeal in the vein.
gruel and oil. That he makes note that she pees at this
Which is
point.
important.
So she poops
Yeah.
because
Important.
she's
We would
really
track that.
dehydrated and sounds like that is something,
her
right?
kidneys
How
woke
Yeah,
up.
no,
It is
yeah,
something.
like, no
actually.
lie. Yeah.
100%. Yeah, we would want to know
She's
that.
getting
Um,
fluid back into the kidneys, which is
good.
good.
right.
It's good.
Enough to start flushing her kidneys, so that's good. And then guess what? More opium, more brandy, more water. And this time he wants to keep her head wet with vinegar and water.
Okay.
Why
Yeah.
vinegar?
I don't.
Maybe for a fever, because it makes people feel cold. Well, grain alcohol does that, but I don't know about vinegar.
I don't know why
It's
he would
old-time
do
Probably,
that.
he's probably just hungry. He wanted some salt and vinegar chips.
Well, maybe it was to cover up the smell.
I mean, maybe he's just like, yeah, just
He's like,
douse
This is
it
a
Same
thing
in-
we
here.
do. Trust me.
Yeah.
Oh yeah,
vinegar
we have
works.
lots of ways. We have ways. Not vinegar.
So the next morning, she did sleep a little bit. She sleeps a little bit that night, and the next morning she's starting to feel a little bit better. The vomiting is occasional.
Like, all right, bro, just leave this poor woman alone. Just leave her
Mhm.
alone. She's on the right track. Don't rock this ship anymore.
Okay, then there's something weird about a great hardness of the bowels. So I wasn't sure. He says that she complains of a great hardness of the bowels. So I couldn't tell if that meant like maybe she's constipated.
I have a theory on that. She could have. There's a term called tenesmus, which is like this urge you have to go to the bathroom, but your colon is
Mm.
basically swollen, and so you can't. I mean, it's not that you can't, but you're like, I have to go, and you try to go, and then nothing really happens because mostly you're just feeling the swelling from whatever illness. It could be illness, it could be other things,
Mhm.
but I suspect after this whole episode, she probably had a degree of that, and so he's of course obsessed with like trying to get these bowel movements, and you're like, just she probably just needs to. You need to leave her alone so she can get better here. So I'm thinking that's what she meant.
Okay.
I don't think it was. There's no way, based on like having a few slices of toast, etc., that she had a giant rock in there waiting. No, don't buy
Yeah.
that. So I
Well,
think
she had a perforation, then food and bacteria got in.
Oh, sure, but it sounds
That's
like
what
she's
I
getting
hear.
better. So I don't think
Yeah,
that's
she's
likely
getting
here.
better. So
To be fair, modern medicine is still very worried about your bowels. So especially on the surgical rotation, that would be I'd pop it in the room at 4:30 in the morning and be like, "Did you poop? Did you poop?
Mm.
Did you poop? How about did you fart?
Mhm.
Did you fart? Did you fart?
Yeah,
Did you fart?
Did you poop?
Okay, all right, bye."
to make sure they're moving.
Yeah.
And if you want to make it even more awkward, be on your OBGYN rotation as a male student at 4 a.m, but bothering these poor postpartum mothers and being like, "Hey, did you have a bowel movement this morning?" I'll never forget the glares. I'm like, "I'm sorry, I'm supposed to do this," or they'll yell at me.
It's nice to know that it goes both ways because as a patient, I'm definitely like, I don't want to say this to this person right now.
Oh no, it's absolutely.
There was no more pitiable figure in our postpartum. My wife would feel terribly sorry for the med student. She's like, "Look at him, he's kind of shaking. Somebody take care of the poor thing." She's like, "Yes, it's
Yeah.
okay." I'm like, "Oh yeah, all
She's
right."
probably nice to them.
She was.
So it sounds like you're saying she's surviving this. Is she surviving this?
She sounds like she's getting better. Yeah.
We have an 1840s case
Where
where
somebody
they looked like
survived.
death in the first 24 hours, and now she's surviving. Does
Yeah.
she survive?
She does survive. He
Wow.
gives her a little bit more of all the randomness. Potass, which I'm guessing is potassium, manganese, ginger, etc.
Ginger's good. I like the ginger.
Okay.
Ginger is
Yeah,
a very
ginger.
effective anti-nausea medicine, like real ginger.
Oh yeah, I have that sometimes.
Yeah.
Hey,
These
all you
days.
need is
Not in medical
Verner's
history.
ginger ale. Do you
Yeah,
guys,
like-
you guys know what
Oh.
Verner's is?
No,
Mm.
but is it like a ginger ale with real ginger in it?
It's a Midwest.
Oh yeah, this is a Detroit staple medication. So like if you
Mm.
had nothing else, you just take Verner's ginger ale. 'Cause it's like a Detroit soda, but it's so gingery and crazy carbonated. Like if you try to inhale near it, you start coughing because it's just CO2 emitting from it. But it is definitely the go-to for any ailment. If your family, like mine, is from the Detroit area and you grew up with Vernors, it's like, oh, your stomach's upset, Vernors. Little sips.
Does it have concrete in it too? It seems to me that would be something that would be in a Detroit soft drink.
Oh God.
It toughens you up, man.
I personally can't figure out why she got better given all the things that are working against her other than sheer will. I mean, she's a 30-year-old woman in the 1840s. She's like,
I will,
you know.
She's probably just cheeking all the drugs and spitting them up.
It might have been the safest thing, honestly.
Timmy won't be without a mother.
Yeah, that's pretty much it. He gives her a saline draft, which, you know, I took to mean just like
saltwater draft. Oh, gross.
What I love is this got published. There's a lady who got sick and then got better, and this got published in the journal.
Yeah. No, I think it was a nice twist. They don't have to be all horrible downward spirals, right?
Wait, was it the Journal of Moderate Diarrhea?
It seems like it may have been. All right, I think it's a good time we could talk about what might have been, because I think that's kind of the maybe the more interesting part. I mean, we've described feculent material in a lot of different ways. So he says, what does he call it? He calls it Cholera Morbus.
Yes, he calls it Cholera Morbus, and he also says. He's got two lines at the end that I was confused about. Hepatic, right? There's a lot of things to be confused about. But he says the state of the secretions in this case indicated very great hepatic derangement and congestion. So like her liver, he's saying that her poop looked weird because of her liver.
Yeah, sure. That
it was cholera, but it wasn't rice poop because her liver was deranged.
That seems like a hand-wavy explanation. He's like, liver did it, and we move on. That was the closing.
Okay.
I think that's bogus. So you could get derangement of your poo from your liver being congested. So the color of your normal poo comes from your liver to a significant degree, right? So the breakdown
I did not
product
know that. Wow.
of your red blood cells it makes your liver secrete bilirubin, and that goes into your intestinal tract, and it's got sort of a greenish brownish color. So if you're completely blocked, you could get very pale stools.
So pale stool is the natural color of stool without bile.
Right. Yeah, it's actually so if you're if you really go say, oh, his liver's congested, meaning blocked, you could have pale stools. And if this lady is got a lot of rice water gruel backed up in her colon and it comes out as pale, maybe that would explain that. But I don't think in this case that has anything to do with anything. I think he's just making stuff up, because I don't see how hepatic congestion. And
he's probably saying liver too, because she had right-sided pain to begin with. So
like,
I can kind of see, you can't do labs. He doesn't have that, so there's no way he's going to put that together.
He also didn't do a very good old-timey exam. There's no discussion of other things that he could have checked. He just gave her a bunch of brandy.
Yeah.
She got better.
And opium.
And opium.
This is why Wisconsinites live so long.
Well, I think
stay at
so.
home and wrap themselves in flannel and drink brandy.
So basically, let me summarize it this way. So 30-year-old woman who goes about, 8 days or so, I think, is the total case. She starts out with a severe right-sided kind of chest abdominal pain. It ends up migrating over to the left as this goes on. A lot of bloody diarrhea and bloody vomiting too. I think we kind of glossed over it, but he describes she was having this dark emesis, this dark vomit. And so then she's like pale and low heart rates, looks really bad, and slowly, despite everything that he's done, gets better. And
he saved a life, Max.
Hey.
Because of.
I don't know if I go that far here, but he, the interesting thing would be what do we think actually happened here? And Aaron, do you have any initial thoughts here?
What
was it? Cholera? Do you think it was cholera? Let's start there, because he called it Cholera Morbus. I said that, and I looked it up. I was it sounds bad, but
no.
This is a antiquated term. They don't use this anymore. But it was like cholera that happens in I think it was autumn or late summer and autumn. It's just
What?
that season of. I mean, cholera had seasons, I'm guessing. So
I don't think
summer cholera in your. So no, I don't think cholera fits here.
No, you never know.
Funny.
Maybe some infectious disease commenter will at me in the comments. But I don't see how cholera would do this, because we know what cholera does. So I
It's
would
predominantly diarrhea, and she had a lot of vomiting too.
So
right? So
I think that, I mean, the
Blood,
pain
yeah.
and the blood suggest ischemia, right? So ischemia is when anything in your body doesn't get enough oxygen and starts to die and hurts. So that's ischemia. So you can have it anywhere, heart, like extremities. But in the gut, it causes severe pain, and it causes gastric emptying, and it causes bleeding, often not right from the start. So that would be the weird part of it. But then afterwards, because the tissue dies because it doesn't have enough oxygen, you get bleeding. Because she survived, like when I initially thought about it, I'm like, fluttering heart. So that's atrial fibrillation, which causes blood clots in the heart. And then it shoots the blood clots off to somewhere. So I was like, oh, she got
you're
a clot.
supposing that fluttering.
Right.
That's everybody who has
I was
ever
like,
had
well,
a fluttering in the
okay.
chest. Let's, not,
Well, that's one way to put it together.
yeah.
I'm looking for Occam's.
supposing.
Yeah, no,
I'm looking for
just
Occam's
to be clear,
razor.
you're theorizing
Yeah,
that
I'm
could have been
using
what it is.
Occam's razor theories. So if you flipped a clot into the gut somewhere and it killed that part of the gut because it didn't have blood flow, it would make her sick. But then she survived. So most of the
Yeah, that
time,
doesn't seem.
when you have bad ischemia, part of the gut, it's bad. It's still terrible. Even now, it's a terrible case.
A surgical emergency with high power antibiotics through an IV.
So, but you can get ischemia of the colon, which tends to be much less awful. So you get pain. Your colon doesn't get enough blood flow, and it like empties its lining, and that would be the bleeding, and that makes you feel, that would cause the pain. And then because her bowels aren't moving, she might vomit. So I don't know. And then I think all the secondary things, the pale limbs, the slow pulse, the cramping, and all that stuff might just be due to shock. Like she doesn't have enough fluid in her body because she's been emptying. So I don't know. That was one thought I had, was, is there some ischemic colitis going on?
Now, would that get better though?
It could, because if she was just healthy enough to survive it, and then over time the brandy and the water. Right now, it tends to be less severe when people get admitted to the hospital, because you give them fluids, and the fluids help with the low blood flow to the colon, and they then start to feel better. But it can be really bad.
I think the question here would be, what in a 30-year-old would be causing that here?
Yeah,
that would be. I think that would be the tougher question, because we tend
Yeah.
to see that in
Yeah.
older populations with like bad circulation,
Right.
in
So still, I
various
would.
areas of the
Gotcha.
body. An inflammatory bowel disorder, though,
Yeah. Okay. So
Yeah.
say more about that.
ulcerative
Crohn's
colitis
disease?
or Crohn's disease.
Yeah.
I mean,
Less likely
I don't think
ulcerative
it's likely
colitis.
here, though. I don't think it's likely. We don't get a longitude, like he didn't follow her for the rest of her life and write that story up, so we don't know if this happened on and off. But it's certainly a thought. I still think infectious disease is
Ooh.
probably more likely here.
What about intussusception?
Oh, that's a very interesting one.
What's
Go into that one.
intussusception,
Ooh,
Mike?
what is that?
Yeah, so it's when
can
the
you spell
bowel
it?
telescopes with INTUSCUSS Enterprise.
Gotcha.
I could. Just
I've
not
never
right now.
spelled that correctly once, ever. It's always been corrected.
Intussusception.
Yeah.
Yeah, I think it was
Intussusception.
SS, not SC. But yeah, part of the bowel telescopes within itself. And then what that can do is that could give you that ischemic part. And let's say that you got right-sided small bowel that you get an intussusception in, that potentially would cause an obstruction or obstructive symptoms. You could get ischemia. That could make you vomit blood potentially. Maybe not bright blood, but you could pass bright blood, and that would potentially resolve without treatment.
Mhm.
And enema could fix it.
Interesting. Yeah,
that's a
very
good
interesting.
point. You're right.
Okay.
Now, we tend to see it more often in kids, but it absolutely can happen to adults.
Yeah, well, she's got like a weird mass in her small bowel or large bowel. So usually you need a lead point, and it's going to be some abnormality like that, like a mass.
Yeah, I think it's
Or a
that's a great
diverticulate.
thought. And then, like, I think to round out maybe the other, again, I was going to say, like, there's still a lot of infectious illnesses that will
Yeah,
cause bad
totally.
bloody diarrhea and vomiting. Like, one of the main ones that we still see today is something called Shigella,
Mhm.
Shigellosis, which is a bacteria, and it produces a toxin. And it just sort of, it breaks down the intestinal lining, and so you get blood and that sort of thing. And generally, Shigellosis, most people will get better without any antibiotics, although we can give antibiotics. There's reasons we're always a little hesitant with bloody diarrhea, because like other things that cause it are certain kinds of E. coli, and some antibiotics, if you give them and you have a specific kind of E. coli, you can get bad side effects from it. There's other bacteria like Campylobacter and stuff.
That could specifically give you right-sided pain too.
Yeah, Yersinia enterocolitica.
Now, how does that
something.
work? That it would give you specifically right-sided pain if it's a specific bacteria.
Yeah, well, that bacteria, that Campylobacter jejuni, causes like jejunitis, which is
On the right
pretty low
side.
in the right low abdomen.
Mm-hmm. In the is it Yersinia enterocolitica, something like that?
gives
It's
like
that
a
can actually give you
cecal
right-sided. It gives you like swollen lymph nodes near where your appendix is, basically, and so it can actually mimic appendicitis.
Is that a part of the colon that you named, Mike?
Jejunum. Yeah.
Yeah. Oh no, the small bowel.
Okay. That and you said that's a part of the low right side. Okay, got it.
Or epiploic appendicitis.
That's in the weeds.
You know, and you're making
No,
that's
that's actually a real thing.
That's a real
It's a real
thing.
thing.
No, God.
Epiploic
Yeah.
appendicitis. Yeah.
It's an appendicitis mimic. Yeah.
Yeah.
So
you have-
tell me why I think Mike is making stuff up, but I believe Aaron says bowel gremlins.
Well, you've done how many episodes with Mike?
Yeah.
This is the thing to be scared about. Like these two guys just 100% accurately listed off so many infectious things that could cause people to get this sick. And the fact that he said she didn't eat anything objectionable is completely consistent with that, because you can't smell or taste these things when you eat them. Like most of these
Yeah.
things will be passed and you're going to have no idea. That's why, still with our food supply, we still 100% get outbreaks of E.
I'm
coli.
sure they had rigid sanitation in
Shigella.
1840s England
Right.
handling this
No, you're a
food.
good point. I mean, all these infections are still going to be there, right? The farmer just, touches the sheep poop and then comes in and makes your food at the diner. So yeah, there's going to
And
be
they
stuff.
weren't pasteurizing milk either,
Nope.
and there was a lot of these get transmitted through milk, especially
That's
E.
where the
coli.
5-second rule comes from.
It's true.
That's right. That's how it goes. So
Oh, what about tox too? Tox stuff.
Yeah, I mean, you got to think about tox stuff. There's no way to prove it here. But I think, again, like a lot of those infectious
Wait, we don't have
diseases
a
that-
resolution for the case?
No, there's no resolution.
better.
She
No
got
answer?
better, Mike. She got
That's
better.
it. She
Can't
got
go back
better.
to
But why in
1840
the
and do
world
labs.
would they even write? I know you said this already, but why would they even write this case up?
She had some diarrhea and then she got better.
Is he like this is an outlier cholera case?
That's, I think, exactly what he was going
Yeah,
with.
but I
I think he
don't
was
think-
trying to say,
Yeah.
is there a
Cholera
new
can
kind of
present
cholera?
in different
kind of
ways.
cholera.
Yeah, because they're still trying to
Cholera
figure this
Morbus.
stuff out.
Yeah.
A lot of those infectious illnesses we mentioned are self-limiting. They tend to
Yeah.
get better in about a week.
Yeah.
And so it might have just been coincidence. She just started clearing the infection
Yeah.
as she was being pumped full of random drugs that he found laying around.
Well, lots of times it's
And,
toxins, right? So that's why it clears, because the toxin has its effect, and then she.
I think those are our possibilities. We won't know for sure, of course, but the good thing is this patient survived. That's a nice twist for this, isn't it? So
Yeah.
that does about do it, Alba. But as our show's most articulate ever medical history intern, what was your favorite thing about today's case? The most interesting thing?
She lived.
The most the most interesting thing about this was that she lived. I gotta say, reading this and how bad off she was doing at the beginning, and then all the stuff he gave her, she got better in spite of him.
Yep.
I think.
That
That is medicine.
is the
People get better in spite of us.
There is
Still
God, I hope
a fair amount of
some
truth to that.
that.
Well, with that, we hope everyone enjoyed this episode, and if you did, please let us know. We'll continue doing them. You could go over to our website and shoot us a message, www.poorhistorianspod.com, or use our social media pages to get in touch with us. Feel free to join us for our regularly scheduled Poor Historians podcast episodes coming out every other week. If you want to find us on social media, please check out our link tree on the show notes here. Give us a follow, help grow our community of medical history aficionados. And if you have time, go and give us a 5-star review on the iTunes, Spotify, wherever else you get your podcasts. Until next time, the Poor Historians are signing out. AMA.